Vicky McGrath, you're the Chief Executive of Rare Diseases Ireland. What are your takeaways?
Gosh. Well, I was told I need to start with describing myself. So I am young in my eyes and in yours, and I clearly am a natural blonde, and we'll leave it at that. So I guess one of the real take-homes for me was data, that we really need to generate data, that we have to, that everything is going to be based around data. The anecdotal stories are fabulous, but we need, I guess, build data around build the stories around data. And, prems and proms and surveys and things, and, we're all that. We are the data. And we have to, I guess, generate the data ourselves as the rare disease community, but we're only going to keep on doing it for so long, and we have to see that this data does drive the change that we're looking for. We cannot be consistently just providing more and more reports and analysis and experience measures and proms and whatever, and still have the same challenges that we're facing in our lived experience, in our homes, in our communities and things like that. So we really want to see this data driving change on the ground. I've heard a lot of it's difficult, it's complex, it's hard. And my question to everybody here is it really? I think a lot of this can be solved by getting the right people around the table and banging the heads together in Europe, in our national governments, in organisations and the regulators and all of those areas. And I think that we need to demand that that happens. We can't continue to ask and to plead and things. We need to drive this change. And it's not just for the benefit of our health, it's for the benefit of Europe's health. And it's for the benefit of innovation and the future and things like that, that if we persist in allowing that things can't happen because there's an obstacle, because there's some type of barrier, it's just, well, how do we work around it? We need to find a solution and get around these things. And I know that there's enormous goodwill in this room with everybody that's here. And so I'd like to see that being harnessed and captured to drive that kind of can-do attitude, I guess. We have seen a small bit of it in Ireland, and I'd like to see a lot more of it in Ireland from the rare disease perspective or from a National Alliance perspective, but also that Europe embraces this opportunity. The blueprint, I guess, is something visionary. I think that we need to be careful as to how we frame it. Some small wins over the next 2 to 3 years, and then looking at some bigger things. But we have to frame it in the current geopolitics. We're not going to be able to get everything that maybe we want as a community, but we should be able to get some stuff, very definitely. I'd say the ERNs, we need to shout from the rooftop as to the value of these and what more they can do for us. I know that Jardin should be coming out next year, or the recommendations from Jardin, and let's drive to June or July 1, 2027, starting to implement these recommendations. Let's not wait for them to come out. Let's actually start planning. We know what the work streams are, who can be involved in the different nations, and start planning. I think that the ERNs can offer an awful lot more value. Newborn screening, why we're all doing our own assessments is beyond me. Access to medicines. Again, these are the experts, so let's use their expertise. Cross-border care. Why do I have to go to my general practitioner and to the consultant and to X, Y, and Z to get an approval to do cross-border care? It should just be there. So I think that the ERNs can add value in the short to medium term and in the long term, and I think that we really need to drive that. The other thing, holistic care, primary care, expert care, care in the community. Clearly, we're not walking hearts or walking lungs. We are a whole person, and we need our systems to address the fact that we are a whole person, and mental health is an enormous gap in the existing systems. Finally, what I would say is innovation. We, as a community, I guess, when you hear about the science that's happening and how individuals and families and small groups of people are driving innovation in this space, be it a care pathway or a clinical guideline, or be it basic research right through to the development of products, raising money, all of those things, that, the investment of time, energy and money that's going into all of this and all of the goodwill, and yet to see that actually the health systems, we're just not ready to take that on, or we're just not ready to invest in that area. And it's kind of like we have to get over that hurdle, guys, because otherwise we're all spinning our wheels and wasting time, and we may as well pack up our tents and go home. And I'm not trying not to be negative, but I just, you know, we really do have to. We have a lot of goodwill, so let's build on it. I would say at this stage I'm exhausted. Amazing community, loads and loads of great conversations. A little bit frustrated, but I know we can get beyond it, and I'm hopeful, and I know that as we take on the EU presidency in Ireland, we will definitely be driving this forward. Thank you.